Good morning, everybody. Once again, Dr. Salim is here with you guys. Let's discuss some more extra questions with their explanations, which helps in our registry examination of ARDMS, American Registry of Diagnostic Medical Sonography. Let's make our SPI examination easier and pass it on the first attempt. Let me share the questions with you guys and let's discuss it together. Okay, so here are the questions. The question is, what are the most common units used for lateral resolution? What do you think? Which one is the correct answer? Is it hertz, millimeter, centimeter, microseconds, or decibels? What do you think? Yes, I'm agree. It's a millimeter because it's the diameter of the beam. So beam diameter will be measured. That's like you're looking for a length of something. So that is millimeter. And also some books will say centimeter, but the question is asking most common units. The most common is millimeter, keep in mind. Okay, next question. Which of the following resolution is operator adjustable? Meaning you who is scanning, the person who is just taking pictures, if that is adjustable by that person, if it's a doctor or technologist or anybody. So is it lateral resolution, axial resolution, is it elevational resolution, none of the above, or all of them? What do you think? Which one is by us, we can control it, we can make some changes on them. Which resolution? Yes, that is true. It is lateral resolution because lateral resolution is adjustable because it is determined by the beam diameter, and beam diameter is adjustable by the focal point, and we have a focus point. We can change the location of focal point. Absolutely correct answer. Let's go for the next one. Okay, so this question is asking all of the following are the other names of lateral resolution except. So there are 4 names, 3 of them are explaining the same lateral resolution, but one of them is not. What do you think? Which one is not the one we can use it for lateral resolution? Yeah, is it angular, transverse, depth, or azimuthal resolution? Which one is not a lateral resolution? Correct. Depth resolution is not refer to the lateral resolution because that is actually the other name for axial resolution. Correct. Absolutely. Let's do this question. It says, calculate lateral resolution at a near zone length 3 if diameter of the transducer is 3 millimeter. So it has a formula. We all know that. I mean, let's see. What do you think? Which one is the correct answer? Is it 3 millimeter? Is it 6 millimeter? Is it 4.5 millimeter? Is it 9 millimeter? At the near zone length 3. What do you think? How much is that? Yes, I'm agree. C is the correct answer, 4.5. Why? Because we said the lateral resolution is determined by the beam diameter, and the formula for that is at NZL1, the beam diameter of the beam diameter is equal to half of the transducer diameter. So the transducer diameter is 3 millimeter. So half NZL1 will be 1.5. And at the NZL2, it will be equal to the beam diameter of the transducer, which will be 3 millimeter. Now they're asking an NZL3. So each time we increase half times. So on the NZL3, it will be 1.5 times extra. On that case, it will be, so 3 is complete 1, and half of that is 1.5. That is a 4.5 millimeter. Correct answer. Let's do the next question. Okay, it says, the focal zone of the beam is the area where the half of it is in the near field and half of it is in the far field. Is this correct? Is it true or false? Or what do you think? Actually, basically, the question is true and false, but I just made it C and D also. But basically, the question is A or B. So what do you think? Which one is correct? A or B? Yes, of course. A is the correct answer. That is the definition of the focal zone. Right? It's not a focal point, it's a focal zone. So that's an area, it's not a specific spot. Correct. Let's do the next question. Okay. Automatically or automatic scanning achieved mechanically, electronically, both mechanically and electronically, or none of them? What do you think? Yes. B is the correct answer because it's automatically, it's out of our control. That is electronically achieved. Absolutely correct. Next question. Electronic imaging scanning achieved by the use of the following transducers. So when we do electronic imaging scanning, What do you think? Which transducer are giving us that type of opportunity? So is it pencil probe? Is it a PDAF probe? Is it all array probes? Is it none of the above? What do you think? Yeah, I'll go to the next question, but you tell me which one is the correct answer. Exactly, it has to be C, array probes. That is absolutely electronically imaging probes. And if you look to pencil probe and PDAF probe, they are not actually imaging probe, correct? They're blind modality. Next question. The combination of active element, wire, and electronic circuit. All these three things, the combination of them in ultron system, the ultron system, what they call it, it has a specific name for that. What do you think? Is it channel? Is it PZT? Is it sound beam? Is it dynamic range? Is it dumping material or backing material? What do you think? Exactly, three of them. When we have active element, the vibration of the crystal, and then the wire, the connection, and then the circuit. So all three is called channel. That is absolutely correct answer. Let's do the next question. Okay, it says, what type of focus is achieved with mechanical transducer? A very easy, simple question. What do you think? Is it electronic, mechanical, no focus achieved with the mechanical transducer, or all of the above? Yes, of course, from the name mechanical transducer, of course it will be mechanical because there's a small crystal, and in the back of the crystal is a small motor or like a small fan. It just moves that. So mechanically they are moving. That is correct. And the focus is also fixed focusing. We cannot move it, correct? It's a fix actually. Okay, next question. What type of steering is achieved with mechanical transducer? Again, it's a simple question. So of course it's a mechanically. The name says mechanical transducer, just I explained it earlier, that there is a small crystal and that is actually moving. So that steering will be also achieved mechanically. Which way? The face of the transducer, because that one crystal will have one direction, one angle will produce the sound or the pulses. So that pulse, whichever the direction is, whichever the face of that is, because it's always in a move, because behind that there is a small fan which is moving, a motor. So it is mechanically correct. Let's do the next question. Very simple questions, correct? What type of image is produced with mechanical transducer? It means what type shape of image is produced. Actually, the question is asking what shape of the picture will be. Is it rectangular shape? Is it blunted top sector shape? Is it trapezoid shape? Is it sector shape? Is it curved shape? What do you think with a mechanical transducer? By the way, mechanical transducer, we scan the deeper structures with that. I will make it easy. Yes, D is the correct answer. Sector shape image. Absolutely correct answer. Next, how many crystals or active elements are there in a mechanical transducer? What do you think? Is it only one crystal or active element? Is it 100 crystals or elements? Is it 96 to 256 crystals or active element? Is it 50 to 200? Is it 46 to 125 crystals? What do you think? Yes, there is only one active element or crystal, and the mechanical transducer is the correct answer. Okay. Next, if crystal is damaged and mechanical transducer or destroy or just it damaged, really maybe trauma or heat or whatever, but the crystal is damaged in mechanical transducer, what do you think? What changes we can see in the picture, in the image? What changes do you see? Is it vertical line drop off will be there? Is it horizontal line drop off will be there? Is it total image will be lost? Or is it a blurry image or unreliable picture? What do you think? Yes, of course. If it's just earlier we said, correct? And the question number 52, we said it has only one crystal. If that crystal is damaged, it means entire picture is gone, correct? So the total picture lost. There is no picture anymore. That's it. Correct. C is the correct answer. Absolutely correct. Let's do the next one. Easy question. Very, very simple question. Now, what does the term array means in linear sequential array transducer? So the basically question is asking, what is array mean in this transducer? Is it array means a crystal activates in groups? Is it crystal activates with a time delay? Is it crystals placed together, close together to each other, like side to side? Is it crystal placed in a straight lane? Or is it crystal activation is in all directions? Why they put array? What does array mean actually? Exactly correct answer. It means C is the correct answer. Crystals placed close together. They're just side to side, close together, side to side. That's what it means. Correct answer. Let's do the next question. Okay, so this question is asking that what does the term sequential means in a linear sequential array transition? Before we just had exactly in the previous question, we had array. What is array mean in linear array sequential probes? Now the question is, what is sequential means in a linear sequential array transducers? Is it all of the, like these are the options? Activation in a group? Is it activated with a time delay? Is it activation in a different direction? Is the crystal placed straight in line, or is it crystals are placed close together? What do you think? Which one is the correct answer? E is not the correct, because just we had E for the above question, correct? So it means on those four, A, B, C, D, which one is the correct answer? Exactly, I'm also agree with you. A is the correct answer. So sequential means their activations are in a group. For example, if there are 200 crystals in a transducer, so we can say 25 crystal, 25. So they will be activating, they activate in the same time, but with a group. Like, for example, I'm just giving you example, 20, 20, or 25, or 30, 30. So to complete the 200 crystals, that is correct. A is the correct answer. Let's do the next one. Now, what does the term phase mean in a linear phase array transducer? So we have probe, right? Echo probes, easy, simple. We have phase array transducer. What is the phase mean in these transducers? What it stands for? Is it activation in a groups? Is it activation with a time delay? Is it activation with a different direction? Is it crystal placed together in a straight lane? Is it crystal placed together, close together to each other? Now, I will make it easy, correct? A and E is not, because we already had them for other options, for other definitions. Now you have B, C, and D. What do you think? Which one is the correct answer among these three? B, C, and D. Yes, B is the correct answer. It means activation with a small time delay, and that time delay is less than 1 microsecond. It means when one crystal is active, the other crystal to the side, that has to wait less than 1 microsecond time delay. And then after that, the next will activate, then the next one, then the next one. So this way, that will go. So that phase means they break, they give break to each other actually. Okay, next, let's do this question. Electronic curvature achieved for the following purposes. You know, we have electronic curvature also an activation of the pulses or crystals. What is the purpose of that electronic curvature? What benefit or what we achieve with that? So is it we achieve focusing with that? We achieve apodization with that? We achieve the demodulation with that? Do we achieve with rejection with that, or all of the above? What do you think? I mean, it's a simple question. Come on, easy. Yes, is the correct. That curvature achieved electronic curvature, that's actually telling us where is your focal point. So focusing is that. If the curvature is more wider, like when it's meant and it's really wider, it means your focal point is really deep. You move the focal point to the depth more deeper. But if you bring the focal point more superficial, that activation becomes tighter actually. Curvature become more tighter. Correct answer. A was the correct answer. Let's do the next one. Okay. How many crystals or active elements are there in a linear sequential array transducer most commonly? Correct? Like, it's a commonly question. It's like, what do you think? Maybe there's less and more, but commonly, how many crystals are there or active elements? And that linear switched array transducers. So is it from 100 to 200? Is it 120 to 250 crystals? Is it more than 500 crystals? Or is it less than 100 crystals? What do you think? Which one is the correct answer? Exactly. B is the correct answer. From 120 to 250. It can be more and less, but this is a range. Commonly, we have this much crystals, and the transducers are a linear sequential array transducers. Okay, let's do this question. Okay, the question is asking that what type of steering is achieved with a linear sequential array transducers? So steering, remember, what do you think? Is it electronically steering? Is it mechanical steering? Is it no steering at all? Or is it A and B, electronically and mechanically, both of them are correct, or E says none of the above? Keep in mind, they're asking for the linear sequential array transducers. Yes, that is correct. C is the correct answer. There is no steering on the linear sequential array transducer. There is no steering. That is absolutely correct. Okay, let's do the last question for this session, actually. It says defective or damaged crystal or active element in a linear sequential array transducer will produce what type of image? Like, what changes do we see in the picture? If we are using a probe, which is a linear sequential array transducer, and there is only one active element or one crystal among those 120 to 250 crystal, one is damaged. What do you see in the picture? What changes do you see? Is it horizontal line drop off? Is it entire image is lost? Is it a vertical line drop off? Is it has no effect? Or is it unreliable image? What do you think? Which one is the correct answer? Absolutely correct answer. C is the correct. A vertical line drop off, vertical, correct, not horizontal, vertical. Where the crystal is damaged, that line will be drop off. Absolutely correct. Okay, thank you, dear healthcare providers. So please, once again, if you think these information can help you and all those who want to sit for the registry examination of the ARDMS, American Register of Diagnostic Medical Sonography, or if they want to sit for CCI examination, Cardiovascular Credentialing International, these are the international two boards and radiology. So if you think they are sitting, or those who really want to increase the level of their knowledge, so please share these clips or these YouTube channel, and please don't forget, tell them to subscribe if they want to have more notifications and more videos. Thanks a lot. Take care. Have a nice day.